Morning guys, we're on day 3 of our look at the knee. First day we looked at the knee anatomy and we saw about the bones and the ligaments, and then yesterday we looked at the medial compartment and we looked at injuries to the meniscus and to the ligaments. Today we're on the other side of the knee, so we're on the lateral aspect, on the outside of the knee. So we've got a couple of structures there that can be injured. In the same way as for our medial side, we've got a ligament, but this time on the outside of the knee, the ligament is smaller, less commonly injured. We also have a meniscus, this moon-shaped piece of cartilage, which again can be injured, but less commonly so. But the most common injury, and the one that I want to address now, is the iliotibial band. And this is an injury or a condition which is typical in sport, but can occur in those individuals who do lots of hill walking, and also in individuals who've had hip problems. So let's start off by having a look at the iliotibial band itself. And we've got Mr. Skeleton here. So the iliotibial band is, as its name would suggest, a band, and it stretches from this part, the rim of the pelvis. And essentially, it travels down from there to the outside of the knee. And it has a strange sort of function. Basically what happens is that the power from the hip muscles, your gluteus maximus and your tensor fasciae lata, feed into the iliotibial band. So the iliotibial band acts a little bit like a sort of a springy rope on the side of the thigh, so that the power from the hip muscles is transmitted to the side of the knee. So it's a very clever design really, which prevents you from having the need to have bulk of muscles on the outside of the knee, which would obviously interfere with the bending and straightening of the knee. So the iliotibial band transmits the force from the hip right down the side of the leg to the knee. And its main function is to stabilize your knee, to sort of lock your knee out when you're standing. So as it travels down from the side of the pelvis here, it runs over two bony prominences, two knobbles if you like. In the top part here, we have the greater trochanter. And that is the knobble of bone that you can feel on the side of the hip when you're lying on your side on a hard surface. The tract then comes down and it passes over another knobble of bone on the outside of the knee called the lateral epicondyle. So as it passes over there, it then attaches or inserts onto the lateral aspect of the knee. And because it passes over these two bony prominences, it can flick over those two, and you come up with the two classical conditions affecting the iliotibial band, and we call them both iliotibial band friction syndromes, typically called snapping hip when it occurs on the hip joint, or clicking knee or runner's knee when it occurs on the outside of the knee joint itself. So essentially what happens then is as you bend and you straighten your knee, the iliotibial band is divided into two portions, into an outer portion and an inner portion. And the inner portion is attached, just trying to get the leg off Mr. Skeleton here. The inner portion is attached along the side of the thigh, so it's fairly immovable. But then you have a superficial portion which attaches below the skin, and it can slide up and down. So as it comes to attach onto the side of the knee here, it's separated by a number of thicker layers, and the ligament itself binds into a structure called the lateral retinaculum, and the lateral retinaculum in turn attaches to the side of the patella. So we have what's called the iliopatellar band on the outside of the kneecap, and on the final day 4 of our knee, we'll be looking at patellofemoral pain syndrome, and that structure becomes important for kneecap type pains. But for our iliotibial band, what people tend to feel is an irritation building up on the side of their knee, particularly when they've been walking for a prolonged period. If you're a hill walker, particularly coming downhill, or if you're a runner, you may find that you notice this dull, achy sensation building up on the outside of the knee. Over a period of time, as that gets a little bit worse, you notice it sometimes when you're walking, you notice it sometimes when you're sitting for a prolonged period, and even when it's very bad at night, particularly when you're lying on your side, your leg sort of falls over to touch the bed and the iliotibial band is placed in a stretched position. So that fact leads us to the first test that we tend to do, which is within physiotherapy. It's called the Ober test, where we will have a patient inside lying, and what we'll do is we'll drop the leg down to try to stretch the iliotibial band, and then we'll move it forwards and back with our thumb to see if we can identify that area of discomfort. So how do we treat this condition? Well, there are a couple of things that we can do. In the painful stage, in what we call the reactive phase, we're trying to calm things down, and that's where things like gentle massage or more vigorous massage or use of a foam roller can help to try really just to target the pain itself. What we then need to do is to build up these hip muscles and to try to build up their endurance. So one of the functions that we have in this with this structure is that as you stand on one leg, your hip should be relatively stable. You don't want to be dipping down on the side of the pelvis. And very often what happens is that when the muscles are weak, after you've been running for a while, your pelvis starts to dip further and further and further, and that's one of the causes of the problem. So we build up the muscles which lead into the iliotibial band. So typically we'll have our subject lying on the side doing a scissor action, or bending the knee, doing a clamshell exercise. Now both of those exercises are performed with the weight of the leg and the foot off the ground, so a so-called open kinetic chain movement. But what we then progress to are closed kinetic chain movements, where your foot is on the ground, you're standing on one leg. So what we would do is perform a hip hitch movement, where I'm lifting this hip upwards using the power of the muscles that feed into the iliotibial band. And then I can also perform an exercise called a mini squat, where I aim to keep my pelvis still, and you might want to put your hand up on something for balance, and all I do is bend and straighten my leg. So I'm performing the exercise on the painful side, and my aim is twofold. Firstly, to keep my leg aligned so that my knee is over my foot. So as I'm performing this exercise, I want to feel my weight on the little toe side of the foot rather than on the big toe side where my foot would flatten. And then as I come further up the body, I'm thinking of keeping my hip level, keeping my hip bones level, and if I just put my hands on my hips, I can feel that they're level, and as I get a bit tired, I can feel if this one starts to drop. So what I'm trying to do is to build up the strength of those muscles and build up my ability to perform that exercise, keeping my hips level. So I'm building up postural endurance. And then we may get our subject on the treadmill and have a look at modifications, typical modifications of the way that we run. So we might look at the foot and say, well, Is the foot flattening excessively? Do we need perhaps to address footwear? Do we need to put an orthotic in the shoe which stops that foot from flattening? As we're running, what is the running pace? So we know that with this condition, that as you increase your running pace and you shorten your stride, the condition will often improve. If you have a pace where you have a longer stride, sometimes the condition can be made worse. So iliotibial tract syndrome, iliotibial band syndrome, or runner's knee. Now, if you have a look on our website, which is www.norrishealth.co.uk, scan across and you'll see that we've got a blog, and in that blog I've got this condition addressed. So it's quite a long article, but it's got lots of nice pictures of the exercises in there. And then if you also get onto our YouTube channel, which is youtube.com/Norris Health, you'll see that I've got videos there of the exercises in a logical progression. So we've got the scissor exercise, we've got the clamshell exercise, we've got the squat exercise, the so-called mini dip exercises and bridge exercises. So you've got those three sort of free resources. You've got the blog itself with all of the information. For therapists, we've got some of the technical stuff with some of the scientific references. I've got descriptions of all of the exercises, and then shoot across to our YouTube channel and you've got somebody actually performing those exercises, talking through with the teaching points. Okay, so that's the outside of the knee, the lateral knee symptoms of iliotibial band syndrome. So hopefully that's useful. Tomorrow, final day, we'll have a look at the pain to the patella. So have a good day.